Hi, my name is Alexis and I am going to demonstrate how to properly apply a bandage. Knowing proper procedures on how to apply a bandage is important for everyone to know. I am certified in first aid. That does not mean that I am a doctor, so the demonstration that I'm going to show you is just a dramatization of what might possibly happen. But there are a few things I'm going to do to help set up the scene before my victim comes out and we practice applying a Band-Aid properly. John fell and got a cut, and he didn't make any noise when he fell, so I had to use his face and his body expressions to know that he was hurt. And that is called expressive communication. And to know what to do to help prevent blood loss is extremely important because you can help save somebody's fingers or limbs depending on the severity of the cut or the wound. Being prepared is extremely important. I always carry a first aid kit with me wherever I go. And I always encourage getting certified in first aid because anything can happen anywhere. And it's always better to be prepared than not be prepared. So a few things to know about first aid. There are 3 things that you have to do before you approach any sort of situation. And it's assess the situation, check the victim, and then call 911. To assess the victim, you want to make sure that the victim is safe and there's nothing dangerous around them. If there is water and the victim got hit by electricity or got electrocuted, you do not want to approach that situation because there could be a chance that you would get hurt also. If it is safe, then you can go ahead and proceed to the victim. It's always best to introduce yourself before you approach somebody, and you always start at their feet so they don't get intimidated by you coming straight at their face. When you explain who you are, see if the person can help explain what had happened if you didn't see it, so that way you know as much information as possible to help the victim in any way possible. The next thing to do is to check the victim out. Check to make sure if they hit their head that their pupils aren't dilated. If they're conscious, check to make sure everything else is okay and it's not just the one area that's hurt. If they are unconscious, you automatically have applied consent if you are first aid certified to go ahead and help the victim as best to your ability as possible. And the third is to call 911. When you call 911, if you have to call from a cell phone, you have to make sure that you know pretty much your exact location or close to where you are, because not every cell phone tower picks up the correct location. When you call 911, explain the situation. If you didn't see what happened, explain everything as best as you can, and then explain what procedures you've helped keep this patient alive in the worst case scenario. So now I'm going to show you these 3 steps in action. Oh, buddy, are you okay? I see that you fell. My name is Alexis and I'm here to help you. Can I see what happened? Oh, you have a pretty nice cut on your arm. Do you remember how you fell? No? Okay. Well, I'm going to help you. I'm going to help get this cut bandaged up, and I'm going to make sure that everything is okay, all right? So the first thing I'm going to do is I'm going to put on my gloves to make sure that everything is safe. You fell pretty hard. Did you just trip on something? Yeah, that happens. I fall a lot too. It's okay. Couldn't get my glove on. Sorry. What's your name?
John.
John. Hi, John. It's nice to meet you. Are you here just playing, or are you by yourself?
Just here.
Just here? All right. All right, you can move your hand. Are you okay to look at blood? Yeah? Okay, let me know if you start to feel dizzy, then we can have you lay down, okay? Do you know what this stuff is called that I'm putting on you?
No.
This is called gauze, and I'm going to put this gauze on until the bleeding stops, okay? Oh, and as you can see, there's still some blood that's coming through. So we're going to put one more piece on. Now, I have all of these pieces of gauze on you, so that way I don't stop what I've started to help heal it, okay? But no more blood has come through, so I'm going to go ahead and wrap it up, and then I'm going to check to see if you got hurt anywhere else, okay? See if anybody else needs to come and help. All right, John, you're all fixed. I hope you feel better.
Thank you.
So as you could see in the video, I kept applying gauze. If I were to take that gauze off of John when he fell, that would just open up the wound again and then the bleeding really wouldn't stop. He obviously didn't get hurt. That was just really good acting on John's part. So in conclusion, what I hope you get from this video is how important it is to learn how to apply a Band-Aid properly. When you work with kids, you are not allowed to apply a Band-Aid if you do not have proper certification. So I hope you enjoyed this presentation. Thanks.